Cardiopulmonary resuscitation (CPR).
Cardiopulmonary resuscitation is a life-saving technique useful in many emergencies, including heart attack or near drowning, in which someone's breathing or heartbeat has stopped.
Beginning of CPR procedures.
Before starting CPR, check: is the person conscious or unconscious? If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?"
Are you okay?
If the person doesn't respond and two people are available, one should call 911 or the local emergency number and one should begin CPR. If you are alone and have immediate access to a telephone, call 911 before beginning CPR, unless you think the person has become unresponsive because of suffocation, such as from drowning.
Help! Somebody please call 999.
Remember CAB STEP. The American Heart Association uses the acronym of CAB, Compression, Airway, Breathing, to help people remember the order to perform the step of CPR.
Compressions restore blood circulation.
1. Put the person on his or her back on a firm surface. 2. Kneel next to the person's neck and shoulder. Place the heel of one hand over the center of the person's chest, between the nipple. Place your other hand on top of the first hand. Keep your elbow straight and position your shoulder directly above your hand. 4. Use your upper body weight as you push straight down on the chest at least 2 inches. Push hard at a rate of about 100 compressions a minute. If you haven't been trained in CPR, continue chest compression until there are signs of movement or until emergency medical personnel take over. If you have been trained in CPR, go on to choking the airway and rescue breathing.
Airway, clear the airway.
1. If you are trained in CPR and you have performed 30 chest compression, open the person's airway using the head tilt chin lift maneuver. Put your palm on the person's forehead and gently tilt the head back. Then, with the other hand, gently lift the chin forward to open the airway. Check for the normal breathing, taking no more than 5 or 10 seconds. Look for the chest motion, listen for normal breath sound, and feel for the person's breath on your cheek and ears. Gasping is not considered to be normal breathing. If the person isn't breathing normally and you are trained in CPR, begin mouth-to-mouth breathing. If you believe the person is unconscious from a heart attack and you haven't been trained in emergency procedure, skip mouth-to-mouth breathing and continue chest compression.
Breathe for the person.
Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing if the mouth is seriously injured or can't be opened. With the airway open, pinch the nostrils shut for the mouth-to-mouth breathing and cover the person's mouth with your making a seal. Prepare to give two rescue breaths. Give the first rescue breath lasting 1 second and watch to see if the chest rises. If it does rise, give the second breath. If the chest doesn't rise, repeat the head to chin lift maneuver and then give the second breath. 30 chest compression followed by 2 rescue breaths is considered 1 second. Resume chest compression to restore circulation. Continue CPR until there are signs of movement or emergency medical personnel take over.
We only getting older, baby. And I've been thinking about it, baby. Does it ever drive?